Respiclick albuterol sulfate inhalation powder is indicated in patients 4 years of age and older for the treatment or prevention of bronchospasm with reversible obstructive airway disease and for the prevention of exercise-induced bronchospasm. ProAir Respiclick may seem different from other inhalers you've used before, but don't worry. Click and Clark are here to help. Let's go over a few do's, don'ts, and how-tos. Okay, ready? Let's go! First, don't use ProAir Respiclick if you are allergic to albuterol sulfate, lactose, or milk proteins, okay? Then, before you use it, always make sure the red cap is closed. And check the back to make sure the number of remaining doses on the dose counter is greater than 0. ProAir Respiclick doesn't have a canister or button to press, and it doesn't need to be primed or shaken before you use it. Then, hold it upright. To load a dose, pull the cap all the way open. You'll hear a click, which means your inhaler is ready to use. But don't open the cap unless you're taking a dose. You'll waste your medicine. Okay, now breathe out as much as you can. Don't breathe out into the mouthpiece. Then, when you're ready, place the mouthpiece between your lips and be sure not to block the vent above the mouthpiece with your lips or fingers. Ooh, that's an important vent. After breathing out, breathe in quickly and deeply through your mouth to deliver the dose of medicine to your lungs. Now, remove the inhaler from your mouth and hold your breath for 10 seconds, or as long as you can. Then, breathe out and close the cap. Because ProAir Respiclick is a dry powder instead of a spray, you may not taste or feel it. So don't take an extra dose from the inhaler even if you do not taste or feel the medicine. But don't worry, that doesn't mean it's not working. Check the dose counter on the back to make sure you received the dose. If your doctor has told you to take 2 doses, let's repeat the steps you just learned. You should start feeling the effects within about 5 minutes. But always remember to close the cap after you're done and keep it closed when you're not using your inhaler. ProAir Respiclick is designed to be used without a spacer. In fact, you couldn't use a spacer even if you tried. If the numbers on the back get below 20 and the numbers turn red, that means it's time to get a refill on your prescription. ProAir Respiclick doesn't need to be washed either. Whatever you do, don't get it wet. It'll ruin the inhaler, and you'll have to get another one. But you can wipe the mouthpiece with a dry cloth or tissue if you want. Store your inhaler at room temperature and keep it out of reach of children when not in use. And don't ever take your inhaler apart. That's not cool. If you ever have questions about your ProAir Respiclick inhaler, ask your doctor or go to proair.com/usage for more info. Now, join Click and Clark for important safety information for ProAir Respiclick.
Approved uses. ProAir Respiclick albuterol sulfate inhalation powder is indicated in patients 4 years of age and older for the treatment or prevention of bronchospasm with reversible obstructive airway disease and for the prevention of exercise-induced bronchospasm. Important safety information. Do not use ProAir Respiclick albuterol sulfate inhalation powder if you are allergic to albuterol sulfate, lactose, or milk proteins. Call your doctor right away if you develop red, itchy bumps on your skin, swelling beneath your skin or in your throat, rash, or worsening trouble breathing. If your symptoms become significantly worse when you use ProAir Respiclick, seek medical attention immediately. This may indicate either a worsening of your asthma or a reaction to the medication. Either of these could be life-threatening. Do not increase your dose or take extra doses of ProAir Respiclick without first talking to your healthcare professional. Before using ProAir Respiclick, be sure to tell your healthcare professional if you have a heart, blood, thyroid or seizure disorder, high blood pressure, diabetes, are pregnant or planning to become pregnant, or are breastfeeding or planning to breastfeed. ProAir Respiclick can cause significant heart-related side effects, such as an increase in pulse, blood pressure, and/or related symptoms. If you have a heart condition, your healthcare professional will determine if ProAir Respiclick is right for you. Make sure your healthcare professional knows all the medicines you are taking, especially other inhaled medicines, other asthma medicines, heart and blood pressure medicines, and drugs that treat depression, because some medicines may interfere with how well your asthma medicines work. Common side effects in patients 12 years of age and older taking ProAir RespiClick include back pain, body aches and pains, upset stomach, sinus headache, and urinary tract infection. Common side effects in patients 4 to 11 years of age taking ProAir RespiClick include upper respiratory infections, mouth and throat pain, and vomiting. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all of the possible side effects of ProAir RespiClick. For more information, ask your healthcare provider or pharmacist. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please click the link below or visit proair.com/PI to see the full prescribing information.
And that's it. If you have any more questions, ask your doctor or visit proair.com/usage for more info. Wave bye-bye!